Yeah.
Oh,
We're recording, folks.
Okay, so physical things that can be seen, touched, smelled, the natural environment or human built environment. I mean, she's in a hospital.
Yeah.
Are we just talking about the hospital here?
No, I
Or-
think we should probably include that
Like work environment
The
work
post.
environment, home.
and her home, yeah. So.
Go for it.
It's messy, but we'll just go with messy.
I stopped highlighting in my book when I got towards the end, and I really wish I didn't, because now I can't find anything. There was a part where she had like literally said, now we, like, when she got moved to the other room, or maybe when she got moved out, that she didn't hear the beeping anymore. I think there was a smell. I can't remember.
Oh,
she
she
was looking
thought it
for the-
smelled like alcohol, like sanitizer.
Like
That
acetone
was
said
what
that when
I-
she was looking for the floor again, she smelled it.
okay.
Mm,
I remember the only thing she like kept saying, or wasn't wanted to eat, or maybe she kept saying it was when they did that test, I think, was apple.
yeah.
Yeah.
That doesn't relate to any of this, but I was just saying.
Oh, here we go. Beeping blood pressure monitors and sad, sick patients was inside the hospital. She also said inside the hospital, it was as if time didn't exist. There were no clocks or calendars. It was a stabilized, static environment. The only thing that punctuated time was endless activity of nurses and doctors.
I would say static environment in the hospital room, except
yeah.
for when there were doctors, because her environment, I feel like, was always changing.
Yeah.
I would say static in regards to time not existing, really, or
Seems
feeling like it
a boring,
existed.
plain environment, yeah. Which is why time goes so slow. Oh my gosh, I'm sorry, I can't see.
No, Lauren, I'm sorry, you can't see.
Thank
Ah,
you. What else is this?
You read what the physical environment consists of one more time.
Yeah. Things that can be seen, touched, smelled, natural environment or human built environment.
Hospital smelt. Was it acetone?
No, that smells like nail polish remover.
No, but
It smelled like
because-
alcohol and sanitizer, I think.
antiseptic.
Antiseptic. There you
Yeah.
go.
Thinking of.
If the hospital smells like acetone, run away.
Someone's gonna catch on fire. I can't.
Okay. So cultural, we were talking about the doctor embellishing her drinks. I think I had something else too.
What was the definition of that again?
Cultural. Shared meanings, expectations, and implicit rules.
Expectation. I mean, go ahead, Sierra.
I was gonna say the expectation between the relationship between like parent-child, boyfriend-girlfriend, doctor-client.
Yeah, that's good. It's also beliefs, customs, traditions, and language.
Somebody put English on there.
Her parents would pray every now and then throughout the book. I don't know if they were that religious. I thought they
I
weren't.
think she even said like they really weren't, but like they felt like it was
Yeah.
like a comfort thing.
Yeah.
Also, I don't know, I put this under cultural, just I don't know if maybe it's just our culture, I don't know, but every time the doctor came up with some like reason something could be happening, she always said that her mom was relieved, is because she had an answer which could have a solution. She also said, oh, this one's a good one. The doctor had the doctor had told her mom that it was because she was partying too hard, not sleeping enough, and working too hard, that her mom was relieved because the solution seemed easy and not as stigmatizing as a mental illness.
I'm gonna put that under professional takeaway too. I'm gonna make a note of that.
Okay. Institutional, I just put like they're wearing lab coats while in the hospital. The cameras on the epilepsy unit. Yeah.
What is social? Riley, can you read that definition?
Interpersonal relationships, emotional, instrumental, and structural support, social inclusion, belonging, stigma, and discrimination. So maybe I should put the non-mental illness diagnosis being more accepted under social instead of cultural.
What do you say the definition? Sorry for social again.
Interpersonal relationships, emotional, instrumental, and structural support, social inclusion, belonging, stigma, and discrimination.
Yeah. You could put it in social.
I'd also say some of those would apply to when she went back to the post illness, or what do you want to call it?
Yeah.
Especially social inclusion.
Yeah.
It took like a month for it to get back to normal.
I would just say like just the stigma of mental illness. Just
Yeah. Yeah, I was gonna say, Sierra, her insurance from the post, I think, covered it all, and didn't they pay out of pocket for the rest?
Yeah.
Her parents could.
Yeah.
What you guys were just talking, who said something that I was gonna say something else?
stigma.
No, what were you guys just talking about?
Stigma going back to work afterwards.
I said something about going back to work, like social.
Oh,
inclusion.
I was gonna say that the people she worked with, I felt like they truly wanted her to return.
Yeah.
Definitely.
I don't know how to put that into words, but like the social aspect where she had a supportive like work career community.
Supportive work community is fine.
And then there was also times, though, at the same time, social wise, like that wedding she went to when she experienced like different looks and stuff.
Oh, yeah.
Because of her figure. That I think that was also after she was Yeah, it was after.
Well, she definitely like she gives her boyfriend looks now to like I'm ready to go after like an hour of being somewhere too.
Yeah, that's exactly what they said. That wedding, yeah.
I like how at the wedding, I don't know, I feel like she went to 2 weddings for some reason, but she was drinking, her mom was like 1 glass of wine and she had wine and then like 6 glasses of champagne. They're
She
like it's
said
the only
that
thing she had
signified her
control
independence.
over.
Yeah, she was like the wine like signifies my independence. It's the only thing. There, I think Lauren, the other thing I was thinking about with the wedding, there was also they went over to like Steven's family's house for something like a birthday maybe or something. I don't remember what it
And
was.
how the older son like
Yeah,
wouldn't look at her really.
it was a reunion maybe.
Something.
Yeah.
But the 6-year-old like hid behind, like she brought gifts and he hid behind the
Yeah.
parents like after. But like the 2-year-olds, I think they like ran up and hugged her because they didn't know any different. Like
Yeah. And
they
the
still
6-year-old
saw her.
remembered what she looked like.
Yeah.
Hmm. Are you ready for occupation?
Yeah.
Occupations are engaged in to satisfy an intrinsic need for self-maintenance, expression, and life satisfaction. So thinking of like groups of tasks that a person engages in and meets his or her self-maintenance, expression, and fulfillment. So some categories would be self-care, productivity, and leisure. Obviously, we know the other occupation areas too, if we want to add to that.
Where should I
But
put her being a cat owner?
I don't
Leisure.
know. Having animals and I don't know. But those are the three like that are under the like that are big under the PEO model.
I would put that either under productivity or under self-care, having an animal.
Wow. Sorry, my aunt went to the wrong house. She was sitting in somebody else's driveway. That's why I told you.
That's funny.
I think we should also add like while she was in the hospital for these three categories, because with the PEO model, it says the three domains are dependent but also affect each other. So like whenever she couldn't do self-care or couldn't be productive or any leisure activities, like that also affected the other two areas.
Can you just write like a note about that at the beginning? Like just to kind of frame the thinking.
Yeah.
Because I think that is a good point. As a patient, her occupations looked very different than as an independent young adult. And as she gained her independence back, it was a process of like gaining back those occupations.
Yeah.
Like when she was in the hospital, at the very beginning, she couldn't shower herself. So the nurses had to give her sponge baths. And then like, if you look at her transition home, the first thing she did was, oh my gosh, I want to shower. And
By
she wouldn't
herself.
take help. So
I don't know if that's how you want me to put that, Sierra. I wish I would have just listened to what you said and typed, but I didn't. It also says that the PEO model takes a lifespan perspective, and so all three domains and occupational performance change over the course of the life. So the model can be viewed as an assessment tool to understand and analyze problematic areas that affect the client's occupational performance, or it can be used as an intervention tool to improve their occupational performance. So just like we just said, knowing that it changed while she was in the hospital can help them view just kind of like her overall performance.
Didn't she try to write journal entries while she was in the hospital?
Yeah, it said it ended up becoming like a diary, like a temporary diary, to look back on and provide insight into the month of being in the hospital. This doesn't really have to do with occupation, but did you guys feel like it was interesting? Like every time that they'd come up with something, her huge long list of symptoms could fit with all those different diagnoses they kept coming up with.
Yeah.
Like they're like, oh yeah, it could be this because this, and this all go with that, and this could be contributing to that. I was like, holy cow, like
They had some
no,
stats
no wonder it's
somewhere.
hard. What?
They had some stats somewhere where it was saying like how many people who are diagnosed with schizophrenia actually, why is so much happening? How
Right.
this, I don't remember where it was. And there was another diagnosis too that gets commonly mixed up.
I liked when it was talking about her diagnoses. I think it was towards the end of like kind of figuring out the plan for it. They talked about if you guys, it's like a tumor. It's a special name. I can't remember the word for
Yeah,
it. But they
teratoma.
yeah, they were just like, if there's a teratoma, then that it's actually the course of the illness is like shorter. So I thought that was interesting too.
Well, because they know the cause of it, so they can at least try and attack the teratoma rather than like, we don't know why your body's attacking your brain.
Okay. Are we ready for the reasoning portion?
I'm going through and adding some more occupations, but I will
That's fine.
catch up with you in a second.
You said three pages, right, Sierra?
Yeah, but I'll make it fit.
Okay. Okay. So narrative, storytelling. I
Right.
mean, really her whole book requires interaction between the client and therapist in order to gain an understanding of the situation. I mean, that's Dr. What is it, Najjar?
Yeah, explaining her.
Do you want me to find that quote?
Yeah, that's a good idea.
Okay. It says that page what is that, 128? Sorry if you can hear that. How's that? Anyone?
Okay,
Oh,
I'm rejoining.
Sorry, I'm multitasking and trying to get ready for work.
Scientific reasoning says this type of reasoning focuses on the facts such as impairments, disabilities, and performance context. It can be used to identify problems and to develop solutions. I mean, I feel like there's a lot of that in here.
I mean, it just gives like in the book, it says understand the meaning of this experience from the client's perspective. And literally the whole book is
right.
from her perspective.
I'm gonna put this. I'm gonna type it and you guys let me, well, I'll say it out loud and you tell me if I should type this. It's when he's like, it's after the clock drawing and he's like trying to figure out what it was. And it says, Dr. Najjar then recalled a series of cases in the recent medical literature about a rare autoimmune disease that affects mostly young women that had come out of University of Pennsylvania. Could that be it? That could be one. Or it's page 133. Or we could put the quote, ruling out schizoaffective disorder, postictal psychosis, and viral encephalitis, and taking into account the high white blood cells in the lumbar puncture, Dr. Najjar had an epiphany. The inflammation was almost certainly the result of an autoimmune reaction caused by my own body. We could put that quote.
Yeah.
That didn't sound like a very
No, I was thinking about ethical.
confident.
I was thinking about using the alcohol, embellishing the alcohol example for that.
That's good. Do you want the page number for that?
Yeah, do you have it highlighted?
I think so.
Riley, do you have the definition to interactive reasoning? I looked it up, but I'm wondering if it's
Mine's is narrative and interactive together.
okay. I wrote something.
Sierra, end of page 50 is part of it. And then page 49 at the like kind of second to last paragraph ish before it says any drug use. That's the part where it starts with, I didn't understand that doctors usually doubled. Put that.
I can get rid of mine then, Riley, if you had something for that. I was thinking of
No, I don't. No,
okay.
my thing like has narrative and interactive in the same definition, so I don't know that I don't have a different definition for it. Or a different thing for that.
Reasoning is interactive, is concerned with the interchanges between the client and therapist.
If you have one, put it.
I did. The reasoning
Okay.
is used when the therapist wants to understand the patient as a person.
In the book, it says for interactive, it's the thinking's directed towards building positive interpersonal relationships with clients, permitting collaborative problem identification and problem solving. For interactive.
I just put when Dr. Najjar, whatever, took the time to take her in and examine her symptoms and explore different pathways and strategies and treatment. I don't know what, I know it's around chapter 15, but that was kind of across multiple chapters. Where'd that go in scientific? I'm not sure.
Okay, pragmatic. This type of reasoning focuses on logistics, such as cost, time, therapist skills, client wishes, and physical location. I think we should, for that one, well, I don't think I highlighted it, so I don't know where it is, but that one, I think we should totally do, you know what? I think it's in the chapter that's called IV, whatever, GV or whatever it is. The part where they're talking about how much money each IV is. You know what I'm talking about?
Yeah.
Oh yeah, they were like $20,000.
Yeah, I was gonna say there's either 10 or 20,000.
Yeah, I just don't know which chapter is that. Or the chapter, something in chapter 41, page 197. There's a lot in there that would go with pragmatic, I think. I can't find the IGV, whatever. IVIG. Oh, here we go. We
Kicked off in 10 minutes again.
Okay, on page 224 at the very bottom. It says, it had cost 1 million to treat me, a number that boggles the mind. That's not a great one.
Well,
Legit-
pragmatic
logistics-
deals with the insurance, doesn't it?
Cost, time, therapist skills, client wishes, and physical location.
I think that you're on to something with it cost so and so how much to.
Here we go. This is what I'm thinking. You tell me if you agree. The third from bottom, where it starts with unfortunately, for most people suffering from severe psychiatric conditions, it's nearly impossible to give everyone the proper testing to diagnose and treat autoimmune disease. PET scans, CT scans, MRIs, IVIG treatment, and plasmapheresis can cost upwards of thousands of dollars each.
Yeah, I like that.
Perfect.
Okay.
I feel like the one I just wrote for interactive is, I guess, kind of what Riley already wrote. But I feel like I could also go in interactive too. I don't know.
Yeah, I think that interactive one is very similar to the narrative one.
Yeah.
What was the interactive? What's it called? Definition?
Do you want the one I have?
Yeah.
You read yours, yeah, Lauren.
Thinking directed towards building a positive interpersonal relationship with clients, permitting collaborative problem identification and problem solving.
So obviously, yes, that's very similar, but I do have a part. So we could do this one. This isn't the one I was thinking of, but on page 163, their thank you note, I highlighted, we came to you with a difficult and desperate situation, and you responded with skill and compassion. I thought that was good.
Yeah, I like that one too.
And then I had on 128, one of the remarkable things about Dr. Najjar was his very personal, heartfelt bedside manner. And on 129, he was determined to never give up on any of them. Oh, his patients. His own story carried with it a moral that applied to all of his patients. He was determined never to give up on any of them. So which one? The bedside manner, never give up, or the thank you note?
I think the bedside manner.
Yeah.
I'm gonna put the thank you note too, like add it as well.
Yeah, I don't think having more than one's gonna.
Because
Yeah,
I think
Becky.
I think it's good. Cool. Anything else, guys?
I mean, we definitely hit our time.
I think that's good.
Actually, the meeting's about to kick us off, so
We
Cool.
can always like revisit it this like before Monday, you know, or what have you, Tuesday, whatever.
yeah,
Okay.
that sounds like a plan to me.
All right.
All right, bye, friends.
Bye.
Bye.